people who are depressed do tend to isolate themselves, partly because of a loss of energy and partly because of the way they're thinking at the time. A lot of people think if somebody's depressed, the way to get them out of it is to sort of get them up, get them going, and get them out there and into activities. And that, I think, for somebody who is mildly depressed, that might in fact help them. And for example, for people who are not severely depressed, exercise, just aerobic exercise, an exercise program has been shown to be as effective in a treatment as medication or other sorts of things. But for somebody who is very seriously depressed, who's really down in the dumps, who's having trouble sleeping and a poor appetite and other of the symptoms of depression, sort of cheerleading them into activities probably doesn't have much effect. There's some evidence that, for example, children who've lost a parent in early childhood are more likely to get depressed as adults than those who haven't. So there's some feeling that early experience may, to some extent, predispose one to depression, and that may be true. Lots of conditions seem to improve with placebo treatment. Depression is one of them. I mean, we don't exactly know how it works, but certainly certain people who are depressed do seem to get some improvement just as a result of being in a treatment situation, which is what placebo really is. You're being in a treatment situation, but you're not getting a specific treatment. And that seems to, reassure a lot of people and give them a sense that something is being done about their illness. And for certain depressed patients, that's enough to set them on the path to recovery. If I were doing a documentary about a psychological thing, I would be interested in those people who are extraordinarily psychologically healthy, who have great resilience, because I think it's just, I don't know if anybody else would be interested in it but me, but I've always been interested in this. There are certain people, who just do very, very well. And what do they have? What is it? I mean, there's been research on this. People who survive very well, even people, all those stories of people who are shipwrecked and they're on rafts and some of them die and some of them live, and what makes the difference?